I made this post the other day about a paraganglioma or carotid body tumor, and a few people were like, oh, how can you distinguish that from a lymph node? These tumors are usually found at the bifurcation at the bulb, and they kind of split or spread the internal carotid and external carotid artery, away from each other. It could also encase those arteries. Now here's an example of a lymph node. So you can see that the bifurcation right there, the two arteries are nice and close together. There's no mass in between them. This is on the outside, very superficial. A lot of times people will have a lump, maybe around right here. And usually lymph nodes are not solitary. They can be, but sometimes they also have another lymph node close to it that's also enlarged. You can see this one with the fatty hilum. Oftentimes they'll present like that, palpable mass. A carotid body tumor is deeper and most likely won't have a mass effect like that unless it's very, very large. Keep in mind that other things can present like this as well, like branchial cleft cysts, which could be anechoic, have low-level echoes like this. It could also have septations. These can become infected, and they can have septations, like I said, and also around the mass there could be inflammatory changes like echogenic fat, edema. Another thing to consider is symptoms. Usually when you have lymphadenitis, you're going to have painful, palpable mass, usually after some type of infection. You could have fever. Here's a chain of swollen lymph nodes in the posterior neck. Now, these are reactive lymphadenitis. In order to diagnose lymphoma, you need to do a biopsy. Lymphomas are usually going to be also enlarged, but much more heterogeneous. And in my experience, when the suspicion is high, they have to do a lymph node biopsy. If the suspicion is low, you can do a follow-up in a few weeks, and usually those swollen lymph nodes will shrink and go away. Lastly, carotid body tumors are pretty rare. Lymphadenopathy is much more common for infectious reasons than for malignant reasons, but you're much more likely to encounter lymphadenopathy over a carotid body tumor. Now, if you do see a mass in between the ICA and ECA at the bifurcation, splaying the blood vessels, if they're very small, it's not going to cause that much splaying. But if it's right there at the root of the bulb, then you should consider a carotid body tumor or paraganglioma. Bye.